So today we're going to discuss an important topic, that is the treatment of chronic kidney disease. For those who tune for the first time, I'm Dr. Francisco. I'm a specialist nephrologist and a transplant immunologist working at Francisco Kidney Medical Center in Singapore. This is the bite-sized information for kidney and related diseases. This video blog is destined to help patients with kidney problems or their relatives, or people at risk of kidney problems, to be better informed so they can understand the disease better and they can discuss the disease better with their own doctor or with me if they choose me, so they can manage the disease better as well. So take better self-care. Self-care is very important and is something that many people forget. They just identify a kidney problem, go and see the doctor. They expect the doctor to give them some medications, sometimes very high expectations of medications, like the medication is going to do all the job, or the medication is going to bring the kidneys back to normal. Unfortunately, that doesn't happen. But it's true, sometimes it is too much expectations. Unfortunately, there is no medication that can make the kidneys better. There have been some claims, there was some little benefit, some side effects of some medications. But so far, there is not something that we can give to patients and make the kidneys better. But what I was trying to go before I started this topic is like many patients, they just go and see the doctor, expect a medication to take home every day, but then they forget about their disease or all the other things that are important in the management. That is, trying to live a healthy lifestyle, improve your diet, do exercise, have a positive mindset, and monitor the disease. Whatever doubts they have, ask the doubts, Google the doubts, join these kind of groups, do something more about the disease. Many patients still don't do that. They just rely on the medication. The medication is one single aspect of the management of kidney problems and many other medical problems. What matters the most is what you actually do for you. Indeed, taking the medications correctly, not missing them, but also what else you do. Have your eyes open for complications, try to lose weight, improve your diet, try to keep your mindset busy, etc. So self-care is crucial. Also, if you take self-care, you are taking also a little bit pride of your care. So your mindset is more positive. Anyway, so I just wanted to do a little bit of a parenthesis on that before we start, while people join. Okay, let's start back to the topic of today, that is, what is the treatment of chronic kidney disease? The treatment or management of chronic kidney disease can be divided into three main rounds. One, the specific treatment of the original cause of the kidney disease. Second, the treatment of the accompanying diseases. And third, the general management. So I repeat, first, one aspect of the treatment is the specific treatment of the original cause of kidney disease, so targeting the cause. Second, the treatment of any other diseases or risk factors that the patient might have. And third, the general management. So all patients with kidney disease, they have to follow also general measures. Okay, so let's start with the specific ones. So the specific treatment aims to control the original cause of the kidney problem and prevent further or continuous damage as consequence of it. If you remember, we commented some causes already of kidney problems. Specific causes of chronic kidney disease include diabetes, high blood pressure, different types of inflammation, like the so-called glomerulonephritis, allergies, urine flow problems, rare diseases, recurrent infections, side effect of medications, or some environmental toxins, etc. So the specific treatment include treating specifically these conditions. I will not be able to mention all the specific treatments for distinct diseases or any other associated condition, but the principle is simple. A specific treatment is directed to specific cause. For instance, if the patient has got diabetes is the cause, aim for blood sugar control and follow all the general measures, all the general recommendations for the management of diabetic patients, knowing that there are also many ways to achieve good diabetic control. Let's say the cause is blood pressure or the accompanying factor as well, aim for good blood pressure control. And do the necessary changes in your diet and lifestyle. Let's say if inflammation is the cause, the patient might need to receive powerful anti-inflammation drugs like steroids or other more targeted and specialized and expensive called immunosuppressive drugs to treat the original disease, to treat it more effectively. And there are also different ways to treat kidney problems. Maybe we have different type of drugs, etc. But we use them in different patients in different way, different doses, different combinations. So there is no rule how to treat patients. So we try to tailor everything to the needs of the disease, the body requirements, and also the preferences of the patient. Some patients might not like to take this sort of drugs, for example, the steroids, because of side effects or because they have their own reason, etc. Sometimes cost, etc. So you need to adapt and try to tailor that to the patients. Yeah. So, and then the second bit is treating any accompanying disease or risk factor, irrespective of being actually the cause or not of the kidney, because then you will prevent extra insults and injuries to the kidney. So not just because your cause of kidney failure or kidney problem is diabetes, you only should focus on the treatment of diabetes, or just because already caused severe problems that you forget about treating diabetes. No. So you need to continue treating diabetes, you need to continue everything. And on the contrary, the more advanced your disease is, the more diseases you have, the more strict you have to be on the care of those diseases to prevent further damage, because the damage, start building up slowly and suddenly, it can lead to a domino effect. So your health can be dropping, and suddenly just goes into a precipice. So you need to try to manage everything. You are a little bit overweight, control your weight. You have your cholesterol really high, control your cholesterol. You eat a lot of salt, stop taking so much salt. You smoke, stop smoking. You binge alcohol, stop binging alcohol. You sleep very little, try to sleep more. You need to change also your lifestyle, your habits for healthy ones. So like your body, recovers better. So as I mentioned, if you do that, you will be preventing further damage to the kidneys, which are already under siege by the original disease. And not only that, everything that you might have or any other toxins that you put in your body. So, and that will be even if the cause, as I mentioned, is diabetes or high blood pressure, is the same. You control diabetes and you control blood pressure. You say the cause of your disease is diabetes, you still control your blood pressure well. And if your high blood pressure damage your kidneys and suddenly happen to be that you develop diabetes, with more reason to control your diabetes well, so to prevent further insults to your kidneys. And then you can prolong the life of the kidneys, yeah? And the last one is the general management. All those general recommendations, to try to manage better your disease or prevent further complications, that are given to patients irrespective of the original cause of the kidney problem, that also aim to halt or retard the progression of the kidney disease. At the same time, as I mentioned, minimizing extra insults to the kidneys, coming from those factors, medications, diet, lifestyle. So to try to prolong as much as we can the kidneys. As I mentioned in the beginning, unfortunately, we're not going to make the kidneys become healthier again or younger or anything like that. It's not going to happen, unfortunately. I need to be frank to you, and I'm frank to all my patients. But you can still receive a benefit. That is, either you allow the disease to still remain stable, or if it's going down, go down slowly, not go down like this. So you need to do all that. But remember, all those general measures depend a lot on what you do every day at home, when you don't see the doctor. When you take the medication, yes, but what you do after you take the medication, that matters a lot. But unfortunately, many doctors and many patients just focus in that medication and forget that the other aspects of their life, if they take care, I repeat, of their diet better lifestyle, better mindset, lose weight, stop smoking, everything that you know that is off scale, if you improve it, your kidneys and your general health will thank you immensely. So, but okay, about the general measures, because there are a lot, I just mentioned in general, but we are going to discuss in following videos about them in more detail, yeah? So, I just wonder if there's any comment. There's no comment yet. In Francisco Kidney Medical Center, we provide empathetic, approachable, and flexible specialist renal and medical care, because we can imagine the struggles our patients and the relatives could face in these situations. So, because simply in Francisco Medical Center, and me, and the doctor there, we care about the physical and mental well-being of our patients. Many of the times, it's not so much the impact of the disease in the body, it's the impact on the mind, the cognition of the awareness of being ill, that maybe your lifespan can be put in jeopardy. You can have a shorter life, or you can have complications. That stress a lot of patients. And it's not so much what is happening inside, because even in the very beginning, as I mentioned before, you don't have any symptoms. But it's the cognition that you are ill, and this can lead to kidney failure, a shortened lifespan, and early death, and things like that. What worries the patients? We are very aware of that, and we focus on all that, try to do it, compassionate, empathetic, but frank at the same time. We need to speak the truth. You need to know what's going on, because if you just don't know what's going on, if you just close an eye, the disease can just enclose you and take over. No, you need to know what is coming, and then you will be able to take better care of your disease. Yeah. So we help you with that in Francisco Medical Center. If you need my help, just contact me. My numbers are there, my emails, and so don't leave it for later. Don't say, okay, maybe later. Your disease needs to be tackled now. Otherwise, the disease is causing a lot of damage inside. Yeah. So we will discuss the general measures in coming videos. I wonder if there's any comment. If not now, do it later in the replay. Take care. I'm Dr. Francisco, wishing you the best possible. Bye-bye.